Good afternoon.
Good afternoon, how are you?
I'm okay. We, as the world is going through the world pandemic of the COVID-19, so many governments have struggled to cope up with the emergencies. So many, especially African countries, were not prepared to handle such magnitude of the pandemic. Specifically in Uganda, we've had other pandemics like Ebola coming, but we've managed to contain it. But COVID is here. In your views, in your opinion, what should the government do to better prepare itself for such emergencies like COVID-19?
My name is Kobusingye Pearl, a communication specialist. I think governments need to generally strengthen their surveillance systems so that they're able to track such pandemics and be able to respond in time. Because I think we have successes and lessons learned from the Ebola response, so we need to improve our tracking and be able to respond in time. I also feel like we need to improve our risk communication, because with such pandemics, it's a new global health security threat. So lots of misinformation, lots of rumors go around in communities. So there's need to improve risk communication so that we're able to respond to rumors in time and provide the right sensitization, the right information, so that people are able to respond in response to such pandemics like COVID-19.
Okay, now that COVID is here, we know that it's not going to go away. Scientists and reports and research have indicated that we're going to have to be in such a period for quite a big, long period of time. In your views, what should the government do to keep on sensitizing and talking to people about this pandemic?
Okay. I think this global pandemic, the COVID-19 pandemic, has showed us that we need, first of all, to increase the amount of money allocated to health in our health budget. Because currently we have 6% allocated to health as per the national cake. And this shows us that, with such pandemics, there is much more need to invest in the health system. The hospitals need to be well equipped, communities need PPEs. So governments, first of all, need to now realize that there is need for us to increase funding or money allocated to health. So, and then the other thing, we need to improve our health services, because right now we are facing a burden on our health services, on our health systems. So there is need for us to improve the services at health facilities so that we're able to test, so that we're able to respond, so that we're able to give the right management to patients, so that there is no burden on the health services. Because right now we are facing challenges, diseases like malaria, HIV, right now are being affected because of the burden of COVID-19.
You're speaking about the government level policy and what the government should do. How about the people on the ground, people in our communities?
I think for the people in the communities, we just need to give the right information at all times and using channels that they appreciate. Radio is one of the most listened to channels that are available. Using community structures, the VHT structure is one of our strongest structures. Using churches, using religious leaders. So we need to use every opportunity available to pass on messages, to be able to inform people, to be able to promote hand washing, use of masks, and all the other PPEs SOPs that we are promoting.
All this is happening during a political time where the political atmosphere is becoming more and more hot. Yet you want the messages to go out there. You're talking about using the churches, the different platforms, which we know are currently a bit locked. Would it interfere with the messages? How can government, Ministry of Health as well as the government, try to correlate the two?
I think the COVID-19 pandemic has also opened an opportunity for multi-sectoral approach, where we need to work with all the different sectors, all the different entities. I talked about using people that are influential. Leaders are very, very influential to our communities. So using leaders in this political season is very key in terms of them being able to pass on messages, being able to encourage communities to adhere to the SOPs, and also them being examples, leading by example, being able to put on a mask when they go out to campaign, when they go out to campaign and be able to talk to their communities. They should live as examples because they are very influential people in our community.
All right. Thank you again for your time, and thank you for your opinions.